So as a lung transplant surgeon, I often diagnose a lung disease that most people have never even heard of commonly. Now it is called non-tuberculous mycobacterial infection or NTM, and it is often mistaken for a routine chest infection. Now here is what makes NTM very different. Unlike tuberculosis, NTM isn't usually spread from person to person, but if you have bronchiectasis, previous TB, COPD, interstitial lung disease, or a weakened immune system, that is when these bacteria can settle in the lungs and slowly cause permanent damage. By the time they reach a specialist, months or even years may have passed. So if you have had a chronic cough, repeated chest infections, and you're producing sputum for months in spite of routine antibiotic treatment, please don't ignore it. Sometimes the problem isn't a stubborn chest infection, but it could be an entirely different infection like a non-tuberculous mycobacterial infection which needs other antibiotics than the routine ones. The earlier it is diagnosed, the better we can protect your lungs.